Welcome to On the Beat. Keeping our kids healthy during this time of year is of utmost importance. And talking to us today is Dr. Naffi. He is joining me from the Children's Health Center of Columbus. And so great topic for so many of us. And we talked before this show, keeping our kids healthy all the time, right? So what time of year do kids typically get sick?
Well, we have peak viral seasons, RSV in October and November, and flu tends to peak December through February, but there's no hard lines on any of that. COVID did kind of shift the sort of typical seasons a bit, and they've kind of stayed shifted.
Okay.
But also, any time's a good time for your kids to get sick or catch something.
Yeah, probably the most inopportune times, right?
Of course.
And so my child gets sick. Mm-hmm. What would be the best way to get them tested, or when should I bring them into the clinic? So
you should bring them into the clinic whenever you're concerned about them.
Okay.
It absolutely helps to have professional eyes set on them. The main things to kind of pay attention to, I always say, their breathing. Breathing is always number one.
Okay.
Right? Hydration, especially for the smaller kids. And just alertness, that they're behaving normally. Kids are allowed to be sick. How would we all feel when we're sick? We're cranky, we're a little fatigued, don't feel like doing too much. That's okay. But that they're alert, that they're responsive, that's important as well.
Such good advice, because you always wonder, am I overreacting? You probably get that a lot, right?
Sure do. Yeah. And it's understandable. That's yes. A mom's job, that's a parent's job, is to be concerned. Might be a little bit of a helicopter parent, and that's all right. Parents are absolutely welcome to bring their kids in. We do have testing available for the full slew of your most common viruses. We do swabs for strep. We have x-rays available if they need a chest x-ray. I personally tend to use my testing a little judiciously.
Okay.
When it comes to viruses, they all pretty much do the same thing. They all last about the same amount of time. And so which particular virus it is, if we know they have a cold, doesn't really matter too much.
Okay.
Usually the viral testing is for the real small babies, and also if the kid has a fever and we're not exactly sure why, it helps to know the source of the infection.
Perfect, yes.
So bring your kids in. When they come in, me personally, what I'm looking for are any signs of a bacterial infection, because we can treat that.
Right. And you can make all these appointments online.
Online.
Perfect.
Call in anytime. We have same-day appointments. Absolutely. Any concerns at all, please come in.
And then is there any way to keep them from getting sick?
There are certain good habits that we should all keep. Wash our hands frequently, cover our mouths when we cough, but especially the smaller the kids are, how are you going to tell them not to touch everything, not to touch each other, not to put their hands in their mouth and other kids' mouths? It's how they explore the world that's around them. That's all brand new to them. So that may be a bit of an exercise in futility, especially when it comes to daycare, preschool. I'll tell you, Karen, I hear often, my kid has been sick for 2 months. It's impossible. If he's got a functioning immune system, he hasn't been sick for 2 months, right?
So the best way is to bring them into you, right?
Bring them into me. We'll talk about it. I love counseling, education. I want the parents to understand what I understand. And if we're on the same page, the kid will be in good hands.
Thank you so much, Dr. Naffi. And that is Children's Health Center of Columbus. Information's on your screen.